Hi everyone. So we have 3 minutes left to start. And I already started live streaming. Maybe I will just cut when I was to start uploading. Hope maybe someone will share for the link on our for the live streaming now. Hi everyone. So we have 3 minutes left. So maybe for Miss Vivien, you will start after 2 videos. It will be Inspired Alliance videos profile first, and then the following with the opening chocolate milk on DRR, and you will start. Thank you.
All right, thanks.
We can do it. Good luck, everyone.
Yeah.
Okay, we will start in 3, 2, 1.
Afi, the voice is not coming.
Inspire Alliance is a network of youth and young professionals working in science, engineering, technology, and innovation.
Inspire Alliance provides the platform for youth and young professionals to connect, engage, and learn from other youth and experts in the region.
We are not only at the international conferences or at the laboratories. Inspire is working together with the local community in the field.
To participate in decision making, demonstrating their ability for advocacy, communication and consultation, as well as leveraging advanced technology.
We strongly believe that inclusivity is the integral factor of the DRR. Hence, all our work and projects are people-centric and from the communities on the ground.
We are committed to supporting youth leadership. We are happy to work with the Inspire Alliance.
Inspire Alliance bridges the gap between professionals and young specialists and make it possible to exchange knowledge and experience between Asian countries to make them more resilient.
We work with youth and the young professionals from the academe and the industry sectors to build back better in a post-pandemic world.
Inspire has connected us and bring us together to contribute for disaster risk reduction and climate change by utilizing science, engineering, technology, and innovation.
Good afternoon, good morning, and good evening. Welcome to our chocolate talk on disaster risk reduction number 7 on the 2 years reflections of COVID-19 pandemic youth and young professional experience. The COVID-19 pandemic is swiping the planet. We, as the individual in the extended human family, are living through a crisis together. For the past 2 years, it has been challenging year for all of us, regardless of who you are, which profession you are from, and we all experience the same but different impact by this pandemic in time of this uncertainty. There is so much to reflect on during this time as the communities around the world are grappling with the impact of COVID-19. So what are the challenges and what are the opportunities that lies ahead of us? This is what we're going to discuss today. And we are pleasure to have 3 speakers who are joining us today despite their busy schedule to share with us their reflections and experience while facing the pandemic crisis. Let us welcome our speakers. So we have our first speaker today, which is from Dr. Arishankery. She is the Principal Assistant Director, Selangor State Health Department from the Ministry of Health, Malaysia. Dr. Arishankery is a medical doctor who worked with Selangor State Health Department throughout the pandemic. She has been appointed as one of the state COVID-19 vaccine coordinator. Combating the pandemic for the past 2 years has been a roller coaster ride and yet extremely privileged to play a significant role for her nation in response to COVID-19. She experienced an incredible eye-opening journey to be able to work with a lot of different forces that came together to fight this pandemic. High-intensity work experience gained from being selected as one of the state coordinator for National COVID-19 Vaccination Program for the Medical Division has landed Dr. Arisha to establish a few new systems that work for the program, including improve the public awareness, instill the knowledge within the community that will hesitate on vaccination via the personal engagement. And with all these achievements that Dr. Arisha has achieved, she just received a Japanese government Max Scholarship to pursue her master's degree on leadership and hospital administrative in Nagoya University. Dr. Arisha is planning to work alongside the key decision maker on public health policy once she returned to Malaysia. And in campaigning the public health advocacy, she envisioned that healthcare able to transcend the borders at local, national, and international level. And it is our great pleasure today that Dr. Arisha is going to share with us Malaysia COVID-19 vaccination program and the tackling vaccine hesitancy. Welcome, Dr. Arisha.
Thank you, Vivien. Hi, hello, everyone. Hello, thank you very much for having me. Thank you to You Inspire and You Inspire Malaysia. And it's such an honor to be able to share my experience here on this platform today. I am thankful to everyone and everything. It's really cold here, so if my voice sounds a little nasal, I'm really sorry. So I think I will go straight to my presentation, if that's okay.
Yep, we can't wait to hear from you.
Okay. Oh, sorry. Can you guys see my slides?
Would it be better to make it into the, yep.
Okay.
There, thanks.
Okay, sorry for the technical glitch. Let me begin. I'm going to talk a little bit today on what Malaysia did over the course of the last year to vaccinate the population of 33 million, about 33 million, and the main challenges that we faced and the lessons that we learned throughout this pandemic, and addressing the COVID-19 vaccine hesitancy in the public. And I will briefly summarize a little bit after I'm done. So let me talk on, sorry, one second. Yeah, so total number of vaccine doses administered worldwide are about 56.6% of the world population is vaccinated, 8.47 billion vaccines administered globally, and 3.63 billion people are fully vaccinated worldwide, which I think is a fantastic achievement, because vaccine is the best solution. And in Malaysia alone, 25,542,969 people have been vaccinated against COVID-19 in Malaysia. So this was the initial strategy for Malaysia when we started the COVID-19 vaccination program. So I was working with one state, which is the most densely populated state in Malaysia, just adjacent to Kuala Lumpur, Selangor. So when it came to response to COVID-19 pandemic, I was working throughout. I was very lucky to be a small, tiny screw in the entire machinery of the COVID-19 pandemic response. And this has been an amazing experience because I really learned a lot. And when it came to the vaccination program, I was trusted upon to conduct the vaccination program for my state. So this was the mandate from my government. We decided to conduct the vaccination program in 3 major phases. Phase 1 being the priority group, of course, healthcare personnel and essential services. Phase 2 were high risk population, especially 60 and above with the comorbidities. And phase 3 were supposed to cover all adults above 18 and above. However, I'm very proud to say that my country was able to ramp up vaccinations really fast. And when we began on February 24th, February 24th was the launch of our vaccination program in Malaysia. And our leaders, our politicians, they kicked off the program by getting vaccinated themselves. And since then, we have had an enormous amount of support, and structurally we have increased and ramped up vaccinations. And I'm very proud to say, before I left Malaysia, by August of 2021, Selangor State, all adults above 18 have been completely vaccinated with 2 doses of COVID-19 vaccination. So the strategies Malaysia did to tackle the vaccination program was through the application called My Sejahtera. And My Sejahtera application also had a website hotline that allowed the public to reach out. outreach programs to rural and interior areas, and through the registration through public or private hospitals, any healthcare facility for that matter. And there were two types of process of vaccination. One was manual vaccination process, and one was the automated appointment by the MySejahtera application. So the automated appointment, you get the appointment, you come for the vaccination, and then you go back home once you're done. The second appointment, the appointment for the second dose is automatically updated in your application, and you just come back again for to the exact same venue for the second dose of the vaccination. In the manual process, you are allowed to reach out and receive the vaccination based on the nearest clinic program, kesehatan, or clinic kesehatan means public health center nearby to you. So I would like to describe what are the challenges that we faced. Some of the challenges that we faced throughout that vaccination program using the 7 key elements of the vaccination program. So program planning and execution was up top from the public policy level and the politicians. It was executed properly, and I was part of the program management. We were in charge of disseminating these vaccinations. Getting the vaccines and procuring the vaccine was the job of our politicians, and we conducted the vaccination program with the help of our previous, the current health minister, who was the minister for Mosti. And when it came to program management, it was really amazing that in my country we were allowed to. No one was discriminated. Every single member of the vaccination program team was given an equal voice to give suggestions or to come up with solutions to problems. Or there was no leader, there was no follower. Everybody was allowed to give their own opinions. Everybody was allowed to come up with creative ideas, and everybody was allowed to give different strategies or propose different strategies to approach a particular issue. We had clinicians, we had NGOs, we had people of various backgrounds and multiple agencies. Every single group of people came together to run this vaccination program. And then there was I'm really sorry. So then there was public engagement and communication. This is where we brought our celebrities, religious leaders, and multitudes of even our politicians themselves set an example by getting vaccinated on the launch of our vaccination program. And then there was there's vaccination procurement, which I mentioned earlier, distribution and logistics, which was it's a mammoth task, because it's a fine line to be able to when the vaccine supply is the global demand for the vaccination is high, to be able to manage the vaccine supply with the limited amount of storage units that we have, and be able to provide enough vaccinations to vaccinate the public who have been given appointments. A very good network and communication system is required to maintain this, and this to make this cogwheel run really smoothly. And ramping up or ramping down the vaccination program once we manage to cover most of the public, and to access people who are underprivileged, the indigenous people who do not have easy access to public health facilities. A lot of factors had to be taken into account when it came to vaccinating all Malaysians, not just Malaysians, all the people in Malaysia. It didn't matter at that point whether you were illegal, legal. We didn't look at status. We didn't look at that point, it was just about getting everyone done, hit hard and fast. And vaccine administration, the technology, and which we definitely have to thank the MySejahtera team, which whereby they had the manual application and also integrated that into the IT system of our app and also the website itself. So this entire program was one major database. Of course, there was a question of PDPR and also data breach or there was a worry. But at that point, the government prioritized the importance of they weighed the risks and benefits, and of course they prioritized the need for the vaccination program to run smoothly and ramped up the security, which was pretty good. And so this was the 7 steps that had basically gone along. So we planned a certain thing, but we managed to pull through way faster than expected. And I'm going to discuss some of the strategies that we applied to increase the rate of vaccination. Like I said, it was a fine line. Being able to manage 24 hours a day, we were always alert and aware, trying to keep the supply sufficient for the number of appointments that we have given out. And as such, we set goals and targets for each centers. We not only had vaccination, when I say vaccination center, we chose vaccination centers to be government hospitals, private hospitals, public health centers, schools, massive convention centers that could vaccinate, that had the capacity to vaccinate 5,000 to 10,000 people per day, and multitudes of companies that had provided their own vaccination, that opened up their own vaccination camps. And each group or each center was allowed to set a goal or set a target. And as such, we decided on how to distribute the vaccinations to them and how to access the road access, because we were very worried about to protect the vaccines. We were worried about we needed police escort every time we needed to take out we were allowed to take out the vaccination from the ultra deep freezers or the storage units. So we actually had police escorting the vaccines every time they were traveling. So this involved many parties, and trust me, it was quite a challenge to maintain that. And communication was key. We had WhatsApp groups, and we had people talking 2 a.m., 3 a.m., it doesn't matter. We were forever in constant contact. We had Google Sheets open live where we could update on how many vaccines have arrived or how many doses have been sent to which center. And this communication was so important when it came to ramping up or ramping down, or if there was an outbreak in a particular community and a particular center had to close down for say 1 or 2 days. So we had to, at a moment's notice, change and modify our structure and modify our plans. And because it was almost impossible to be able to, we did not want to stop the vaccination program just because of an outbreak. And we wanted to encourage engagement of multiple parties. This involved politicians, religious leaders, celebrities, influencers, everybody. We encouraged everybody to post on social media, to call out for vaccination, to ask young, healthy individuals who could come for vaccination to come forward and get the vaccination and post on social media. And increasing accessibility to vaccines and information. We had the government was transparent right from day one when they had launched the website in our Ministry of Health website, where we had a press conference by my Director General of Health, where daily number of cases were reported. And even when it comes to vaccines, then we had a website that gave total number of vaccinated per day, which centers had what vaccines, and all the information about each vaccine available in the country and what were the possible side effects and how to, they could even respond in their application, the side effects that they experienced after the vaccination on the same application that gave them the appointment for the vaccination, and someone would reach out. So that was how we were engaging constantly with the public. And target specific vaccination was especially crucial for our hospitals because we had high risk people like cancer patients and like I mentioned, the indigenous people, or people who Or students, once we started vaccinating, like I said, once we by August we had almost done with adult vaccination, and we were already midway through vaccinating 12 and above. So when it came to strategizing school students, we had to open up vaccination centers at a particular targeted school. Or when, like I mentioned, ESRF patients, they are a group that are very vulnerable, and the highest number of mortality of COVID-19 can be seen in ESRF patients. So we had to protect them. They cannot go to the public vaccination centers. So we had to cordon them and give them priority for vaccination, and also ensure that their vaccination center was suitable for their capacity, because they are weaker, and not just immune system wise, even physically, they may not be able to climb stairs and things like that. And we also encouraged and support creative vaccination strategies, such as mobile vaccination teams. We had, even each state health department had their own mobile vaccination teams. We had cars running around, going to houses, vaccinating elderly population that are not mobile, that are unable to walk, mentally retarded homes, mentally retarded people, or orphanages, old folks' homes. And we had buses that were converted into mobile vaccine centers, and that were traveling throughout the country during this time to go to a particular housing area or a community and to vaccinate them. And then we also had we had drive-through vaccination centers, which was amazing for those who didn't want to come in contact with people. They had virtual consent forms, and they drove through, just got their vaccination and left. So we had multiple strategies and multitude of methods to approach this one particular issue. So like I mentioned, comprehensive and transparent reporting system was established. Even till now, till today, this screenshot that I share is from this morning. You can see that the total daily administered population and our total population is not achieved, because the vaccination is not for those less than 12 years old. So we don't expect the vaccination to be 100% in this total population number. But adolescent number of vaccination are increasing, and Malaysia is going towards 100% vaccination, at least for those 12 and above, where the vaccine is approved for now. And I would like to address a little on vaccine hesitancy: complacency, confidence, and convenience. This is the three key to any vaccine hesitancy, not just COVID-19, just vaccine hesitancy in general, where people perceive the risk. When it comes to complacency, they perceive the risk of vaccine preventable diseases. They rather stay home. They say, people give excuse such as, I never go out anyway, so why do I need to be vaccinated? Or they don't have confidence in the vaccine or the health authorities or the delivery system, and with the whole conspiracy of big pharma. And there's a lot of barriers, and I was so proud that my country actually broke red tapes and broke barriers, and just came together to ensure the availability and accessibility towards the vaccine. So when you increase accessibility, and when I say affordability, COVID-19 vaccination was provided 100% free for everyone in Malaysia. And acceptability of services, people were allowed to walk up to a vaccination center, approach them, and tell them that they want to be vaccinated. In the event there was no vaccine available at the point, these people would be called back for an appointment. So convenience, confidence, and complacency, that's the main reasons for vaccine hesitancy. And how to overcome it: patient-provider communication and using social media. When I say patient-provider communication, I mean each and every healthcare worker in the community can work as an ambassador to actually improve communication between the patient and the provider, to ensure questions or doubts about vaccines can be clarified. Using social media, government agencies, non-government agencies, tailoring information strategies specific to particular group or target group, and expanding vaccine availability, like I mentioned earlier, reducing financial barriers. We made it free. Finding vaccine champions. We had ambassadors, and even our health minister himself was an ambassador of vaccination program. And this is just a repetition, basically: media and public communication, local politics, religion, culture, accessibility of services, and trust in authorities. To tackle each and every one of these contextual issues, these factors, we need to go delve down. We need to find out why they are vaccine hesitant. Find that one issue and tackle the issue, and make them understand what is the solution to that. And when it comes to individual and group influences, beliefs and attitude about health, knowledge and awareness, poor quality of health services, experiences, vaccines and vaccine-specific issues like mode of administration, source of the vaccine, vaccination schedule, the cost associated. When I say vaccination schedule, a lot of employees also opened up in Malaysia and said, okay, if you are going for vaccination, we are going to give you half day off or the day off for your vaccination program, which I think was fantastic because everybody came together, and this in turn encouraged workers to go and get vaccinated. Knowledge, attitudes of healthcare personnel, because they are, like I mentioned, ambassadors. And like I said, directly addressing the issues. COVID-19, we have to inform them that there are a lot of false information out there, and we have to inform every single person individually in the community how we have to tackle their question. They come up with questions like, will it change my DNA? No, COVID-19 does not change your DNA. Vaccine does not change your DNA. And it does not give you COVID-19 if you don't have COVID-19. So such individual specific problems, every single person has their own problems, and someone has to address that. We had hotlines, and yeah. This is from WHO to tackle vaccine hesitancy: ask, provide, and verify. So ask information. This was a talk that we gave. We gave a training session to all healthcare workers in the state to make them champions or ambassadors, or make them the voices of the healthcare system to encourage the public to come and get vaccinated. So we trained them to address vaccine hesitancy in the public. Begin with their family and expand further towards their community. So we taught them these three: ask, provide, verify method, which is ask information on what the client knows about the vaccine. Provide information. We constantly gave handouts and electronic information, and even the website, Malaysian government Ministry of Health website, has multitude of information regarding each and every vaccine available. And we ask them again, verify what they have understood from the information that we shared with them. So this was the program that we ran in my state health department, where we provided the information to all healthcare workers and encouraged them to in turn encourage the community to engage in vaccination. So my take on vaccination, or any program for that matter, the key to a successful program would be support from leaders. Definitely, we need the support from leaders who are able to accept when there is a barrier, help us break down barriers, and help us use their influence to improve outreach and teamwork. Multiple agencies, like I mentioned, NGOs, the state government, the central government, even private bodies or companies came forward and volunteered to work in the vaccination centers, which was amazing, simply amazing. And the importance of open communication, always have communication between parties. This when there's communication, when there's any doubt, communication can solve and clarify the doubts. And I think that can help bring the success of a program. Educating and empowering the community would definitely solve the problem of vaccine hesitancy and provide herd immunity eventually, hopefully. So I think this is my last slide. So anyone can stop me and ask me any questions if there's any. Please do.
Thank you, Dr. Arisha. I know lots of you wanted to ask a lot of questions to Dr. Arisha, especially when Dr. has shared a lot of positive and successful story about the Malaysia National Vaccination Program. But I wanted to remind you is you can keep the answer to you keep the question to yourself, because we are going to have the Q&A session after we listen to another two speakers. So yes, you have question. Keep the question to yourself. Don't worry. I will ensure that Dr. Arisha will stay together with us until the end of the session. Right. Thanks, Dr. Arisha. Thanks for sharing us the coordinated, comprehensive, inclusive, and national approach to vaccine access in Malaysia, especially on the vaccine allocation and prioritization to ensure the equitable access. And from your talk, I have one take, which is none of us are safe until all of us are safe. So the COVID-19 pandemic has reminded the world of the power of vaccine to fight the disease and save life and create a healthier, safer, and more prosperous futures by leaving no one behind. That include the vulnerable group, marginalized community, foreign citizen, and etc. And Dr. Arisha also shared with us that a multidisciplinary collaboration between not only the healthcare personnel, but health risk communication team, administrative management, even the data scientists are in when it comes to the national vaccination programs. Yes. So if you still have doubt that what you can be done, because I'm not from the healthcare background, I don't know what I can do, you should really listen back to Dr. Arisha talk through our YouTube or Facebook Live later. And then you will find that that is a way for you as a young professional to advocate for vaccination over those who anti-vaccine. Let your voice hear. Let you be the future change maker and the ambassador to start talking about the vaccination, because without you, we don't know how to go back to the normalcy. Thank you, Dr. Arisha. And don't leave us, because a lot of questions is coming in, pouring in, waiting to ask you. Right, let's have our next speaker, which is Mr. Ahmad from Afghanistan. He is the head of staff, State Ministry for Disaster Management and Humanitarian Affairs from Afghanistan. Mr. Ahmad holds a master's degree in transportation engineering. He currently works in the Kabul Municipal as the director of District 11. He represented UNINSPIRE Afghanistan chapters in UNINSPIRE Alliance. As an ex-employee of Afghanistan National Disaster Management Authority, he has a clear picture of disaster risk management in Afghanistan with all its challenges in his mind, and is working along with all the young and youth professionals to at least find some solution to it. He was a member of the team who developed the Afghanistan strategy for disaster risk reduction in line with the Sendai framework, coordinated the Sendai framework monitor, and personally uploaded report of 2 years from Afghanistan into the Sendai framework monitor. Welcome, Mr. Amarisha, and he's going to share with us on the title Afghanistan COVID-19 and Conflict. Up to you, Mr. Ahmad.
Thanks a lot, Vivien. I was listening to presentation of Dr. Arisha. Actually, I felt the inclusivity of UNINSPIRE, because we are, I think, we are living in different part of the world, and the situation is totally different. Nowadays, we are tackling to survive from hunger and drought and poverty. And in the other part of the world, their concern is to get vaccine. And that is a success for UNINSPIRE, that it is inclusive, and different parts of the world can be part of it, and can share their thoughts and ideas, and also their situations to the rest of the world. It is a pleasure for me to be here, and let me check. Sorry for seconds. Yeah. Apologies that I'm not in a good mood, because I was just thinking about the current situation of my country, and I got emotional. Hello, everyone. Good morning, good afternoon, and good evening. Those who are joining from different parts of the world. It's a pleasure for me to be one of the speakers for the Choco Talk DRR Session 7 to share some experiences about the past 2 years of COVID-19, and also which is collide with the conflict in our country, which has already been captured by the insurgents, and there is no any official and selected government, and lots of problems are there. I would like to share some of the experience that we passed through the past 2 years, and also I want to make it clear that the presentation has no any scientific. It's not a outcome of any scientific research or any proper data management. Just it is some bullet points from our experience that I will narrate and I will explain some of the points. Actually, when the word conflict is coming in mind, there is nothing prior to that, and this kind of pandemic or other disasters cannot be a priority for the country and its government. Unfortunately, this is a problem. And when conflict is there, you all know that Afghanistan is suffering from conflict since 40 years, and still it is going on. The vulnerability of people is very high in terms of disaster in pandemic, and the capacity is very low. It is obvious in weak governance, and corrupt governance is always a concern for the international community, as well as for the Afghanistan nation, and lack of sense of urgency to prioritize disaster risk reduction, because it has lots of casualties in loss of infrastructures, loss of economy, assets, but it never get a priority or get attention of the political leaders to be a priority for government to tackle it. Please, if you can bring the slide, yeah, thank you. It is already there because I need to open my short notes, because I don't want to lose the track of my speaking. Yeah. At the very beginning, the state government of Afghanistan established a new high commission to deal with the pandemic-related activities, which was a very, as my opinion, it was not a good decision, because the mechanism and also the channels were in place already through law and other regulations. But when government decided to establish a new high commission, it creates a controversial things between organization, and it weakened the coordination between organizations. The government aim was to reduce the corruption, and also to have a full focus on the activities related to pandemic, and reduce the risk of the pandemic for the nation. But unfortunately, it went wrong, and the establishment of new high commission demoralized some of the authorities in different organizations, and they do not support the high commission. And finally, some of the member of the high commission accused for massive corruption, unfortunately, at the end, and it was a very wrong decision. And if you can bring the next slide, please, slide number 4, Afifa. Yeah. No, go backward, I think. Yes, thank you. Yeah, this is okay. This is okay. No. Yeah, this is okay. Thank you. And as far as DRR is concerned, since it is a multidisciplinary, as Dr. Arisha said already, in the community's responsibility is very crucial. But unfortunately, in many cases, we witnessed that people were not obeying laws, rules, and regulations. They were justifying in a way that we could not force them a lot as government officials. One of the justifications that they were always facing as such challenge, that they said we are just dealing with the daily substances to have food and eat to survive. And if you are going to quarantine our business, tomorrow we don't have anything in our home to eat and survive. It was a big challenge for us to deal with it in a very simple thing, that was a quarantine. We could only quarantine the governmental offices and also schools and some of other organizations, but the crowded bazaars and markets, we could not apply it very properly because of these problems. But the developing guideline, rules and regulations, our country has done a lot of good works and practices. They distributed lots of guidelines, brochures, flyers to different parts of Afghanistan, to very remote areas of Afghanistan, to give awareness for the people, those who do not have access to social media and other mode of communication, or this media kind of things. Our government has done a good job on that, and also dedication of hospital, or at least isolated wards for COVID patients in all provinces of Afghanistan. We had at least 1 or 2 hospitals, or some wards in different hospitals isolated for this kind of patients to be taken care of. And since more than 70% of population were living under poverty line, it was another cost that people were not able to stay at home and observe the quarantine. The small businesses, instead of being kind and helpful, were trying to misusing from this opportunity. That was another challenge that we faced. Small entrepreneurs and also shopkeepers were trying to store their to keep their stores for the high price to sell it again, and people were suffering a lot from this phenomena, and we could not force them to open their markets for the people, and that was a complex problem that was very difficult for us to deal with it. First, we had good experience and good practice while distributing aid for the people of Afghanistan, for our nation. The first batch was a little bit not good. It went wrong, and the amount and also the combination of materials that we distributed was not sufficient, and it changed to a kind of joke for our media and people. keeping that experience in mind, we focused more in for the second and third batch of AIDS for all the people who suffered from the COVID-19, and it was near to change another burden of a threat for our national security. We could control it, and we could calm down the people by distributing second and third batch of the humanitarian aid. And yeah, public awareness has done a properly and efficiently. The news was spread widely, and everyone was aware of what is happening and how avoid getting infected with the virus. I already mentioned that our government was quite good in this practice, and telecommunication played a very strong role in public awareness. While we were calling to someone, and an automatic message was just repeating the same thing, that stay at home and wash your hands, and this kind of message that it's more related to healthcare sections. I don't want to touch it more, but it was very good. It was a repetition of the guidance for the people to take care of themselves. In the dead body management, also at the initial stage of coronavirus in Afghanistan, it was good. People were respecting the rule applied by government. People or family of the person who has passed away due to coronavirus was not were not involved in the funeral ceremony and other stuff like that. They just left the dead body for the government, and government different departments of the government were responsible to do the funeral ceremony, and also since that 99% or 99% of the population are Muslim, they needed to have a janaza prayer, which is a must for Afghanistan people. But it was also done by government, and the funeral ceremony was doing like that. But after the first wave of coronavirus, for the second and third wave, people were not, people just break that rule, and they start to be involved and intervene to the government applications and also procedures, and everything was just damaged, and people were dealing with the dead body themselves, and that made the percentage of people, those who were infected, double and triple. After that, it was a very bad practice. It was a responsibility of community to respect, but unfortunately they did not. Next slide, please. Community contribution was also not satisfactory, since they passed more than 30 years of continuous war, and people were very aggressive and rough against the government while applying preventive measures like quarantine and stuff like this. People did not observe the quarantine, and they were not so helpful and cooperative with the government. I already mentioned. The healthcare champion personnel always suffered and were too vulnerable. First, they were exposed to virus more than other people. On the other hand, they were vulnerable facing with the people that they do not respect rules and regulations. They have beaten by people. In many cases, we witnessed in the hospitals and other health care centers, unfortunately. Small businesses owner and small entrepreneurs were also misusing this opportunity to get or gain more benefits. Next, please. Yeah, civil society was quite good in helping the government and going shoulder by shoulder with the government officials to tackle with it. And they were active in the public awareness, and also they were active in being a part of the team that they were distributed the aids for the needy people to ensure the transparency and also to ensure that aid is properly being distributed to needy people without any lossage. And media organizations, they have done a great job in terms of public awareness and also reporting back the evidence and problems to people of Afghanistan. Religion scholars like mullahs, those who are responsible of masjids and praying with the people in Jummah praise, they are always trying to encourage people to get vaccine and also to take care of the preventive measures to avoid increasing infections. And youth and youngs also are a very active part of the nation. Within these 2 years, we had lots of volunteer teams to work in different parts. If it was distribution of aids, if it was public awareness, if it was encouraging people to get vaccinated. In many layers, youth and young were very active, fortunately. Next, please. Yeah, what we could do, this picture, if you can see, I'm in a local traditional clothes, wear traditional clothes, and distributing mask and also medical gloves for the people in a district of in a province of Afghanistan. And in the streets, there was lots of commuters and cars going up and down, and we were distributing and also conveying the message of healthcare personnel and Ministry of Public Health for the people to at least can reduce the rate of the number of people who are getting infected by this pandemic or virus. Disinfection activities voluntarily, we a very good experience that we had was disinfection activities in a very crowded places like masjids and also other gathering places like some small markets. We purchased disinfection materials or sprays, and with our own expenses, we could do this activity in lots of areas. And also we encouraged other people to take part and to do the same to reduce the rate of infections. And also encourage people to obey the rules and regulations which were applied by different authorities and ministries. Next, please. Yeah, we all shift our observations in 3 categories: good practices that we can repeat it and we can do it in the same situations in the future. And also the things that can be improved in the future. It was not quite good, and also in the things that should not be repeated in the future to avoid loss of resources and use opportunities in proper and efficient ways. Unfortunately, as I shared before, that since 4 months, our official and selected government collapsed, and nowadays the control of the country is controlled by controlling by insurgents Taliban, and everything is not in place and not proper. And this data and information is also stored, but we hope to use it in the future if we have a operation government. The one of the very important and also very it was very difficult for me while making this presentation. I was trying to get some data and information from the Ministry of Public Health Facebook page, because they were very active in the Facebook page. After Taliban take over the control of country, Meta company or Facebook just delete their official page, and all the data and information is spoiled, and at least I could not find proper data. And when I entered to their websites, that was also not updated. It had a very weak and old version of information, that it's all about the conflict that just begging us to progress and to go ahead with the rest of the world. Next, please. Yeah, just I would like to update, while it is very irrelevant to our topic, but I would like to use this opportunity to have an update for you guys about the current situation of Afghanistan. Fortunately, more than 70% of the population, it means 20, I wrote it down here, I would like to share it with you. 23 million out of 32 million people require urgent food assistance based on the WFP reports. And the humanitarian crisis is just increasing day by day. Unfortunately, only 5% of the population has enough food to eat. Rest, they don't have enough food to eat, and 70% of the population needs urgent food assistance. This is the current situation, and the COVID-19 and the vaccination is still a very priority. Maybe it might be priority number 4 and 5, because nowadays our existence of our states or our government, our country is under a big question. And unfortunately, we are facing and we are passing very bad days. Just pray for us, pray for people of Afghanistan, because last 2 days I heard a news that a person was trying to sell their children to save rest of their family, and it was very painful for me. I'm sorry, it was all from my side.
We having Mr. Yeah, I think Russia needs some time. It's not easy, Rasa. We know that COVID-19 is one of the many crises that facing Afghanistan. And the political and the military advance in the country had definitely reduced the healthcare capacity and had imminent humanitarian crisis risk exacerbating an already very serious threat posed by the COVID-19 in Afghanistan. We hear you, Reshad. Thanks for sharing with us the COVID-19 and the conflict situations in Afghanistan.
Thank you. I'm sorry, I just get a little bit
No.
emotion. And,
Thanks for
I'm
letting
very
us
sorry.
know. We don't usually hear this from any mainstream social media. It's only through you that we understand what is actually happening in the Afghanistan. And we definitely wanted to learn and hear more from your country. Right,
Thanks a
so
lot. Thank you.
stay with us, Reza, because we are going to have the Q&A session, and I'm sure that there's a lot more we wanted to know, we wanted to help, we wanted to collaborate, we wanted to support in helping the people in Afghanistan.
Yeah, sure. I would like to thank you again for giving me this opportunity to use this platform and share that experience from Afghanistan. Thanks a lot. I will be here to
Yep.
participate in
Please,
the question
Reza.
and answer. Yeah.
Sure. Thank you, Reza. Right. Next, we will have another of our speaker, which is Aditya Putra. Aditya Putra is currently working and studying at the Atma Jaya Hospital and a primary healthcare facility in Indonesia. He's engaged in helping COVID-19. Hi, Aditya. Aditya is engaged in helping COVID-19 vaccination daily and gain a valuable experience collaborating with the great people from government officers, NGO, public figures, religions, leaders, healthcare practitioners, and university students from all over Indonesia. And the aim is to plan, execute, and evaluate COVID-19 mitigation and risk reduction program. He is interested in connecting all the potential initiatives around him and believes that he could achieve more things through collaboration. He had experience on leading organization, team organizing events, and working on national and international projects. As a research assistant, he enjoyed the journey of working on various publications, mainly on neurology, connective, and also degenerative medicines. So as a medicine student, Mr. Aditya Putra would definitely have a lot of reflections to share with us. So he's going to share with us on the university involvement in improving primary healthcare ability to control COVID-19 transmission in the community. After you, Mr. Aditya.
Okay, thank you for the very warm welcome from Dr. Vivien. I would like also firstly try to address my deepest warm and greeting and gratitude because I could teach and attend this vocal talk with all inspiring speakers before me. Also praying for Mr. Reshad and team in Afghanistan of the best health and also physically and mentally, because I think this is a very hard situation all over the world. I'm trying to end this vocal talk with a high note, with a big hope, and by reflecting with you guys some of my experience with team in Indonesia, but how we try to involve the university students in improving primary healthcare stability, controlling community transmission of COVID-19. And this talk will be based on our experience of involving university students in contact tracing and testing in Bali. I guess you all know, sometimes people try to acknowledge Indonesia as Bali. The opportunity given to us to work in the Bali, because Bali still nowadays being the spotlight or the highlight of Indonesia. They mainly survive from tourism activities, and COVID-19 of course affected. First of all, I want to introduce myself. My name is Aditya Putra. I'm very glad to be here. I might not be the most influential person, or maybe the most capable person, but here I am trying to represent myself. I don't use a proper clothing because this is how I work, and I would like to firstly tell you guys about how flattening the transmission curve is possible in ideal settings where primary healthcare PHC is responsive to critical situations, and this is also backed up by World Bank article back in June 2021. But how well-designed primary healthcare can help flatten the curve. Indonesia, as a very big country, rely on primary healthcare in addressing medical situations. However, in limited resources and increasing workload situation, collapsing PHC are having difficulty keeping up with the COVID mitigation while maintaining essential primary healthcare services. As a result, regardless of the bed occupancy ratio or BOR, COVID-19 cases increase in communities. This is the key point. As a result, consequently, COVID-19 transmission persists in the community with the growing number of undetected or undocumented contact with people tested positive for COVID-19 and ultimately rising deaths of people in self-isolation. Indonesian national and regional governments have recognized the need for collaboration between healthcare services, civil servants, and the community, including the National Military of Indonesia, TNI, and the Indonesian Police Force, or Polri, which I will mention TNI Polri from now on. Nevertheless, the harmonization and optimization in some regions face several barriers, including these are the barriers that we found before the study, and they are tracing data. It is not inputted directly to the monitoring system due to the increasing workload and limited workforce, limited capacity of TNI Polri in reporting contact tracing data to the monitoring system, and ultimately the discrepancy of data inputted and produced by different monitoring systems used between the national and regional governments. And another technical and administrative obstacles related to the user interface, features, and data integration which are found in the monitoring systems. During the community transmission, countries and the regions have to increase their capacity of tracing, testing, and treating the COVID-19 patients while maintaining their essential services. It is achievable through creating and implementing comprehensive and updated data-driven policies. And these actions are critical to prevent rapid increase of deaths in self-isolation, because the tip of the iceberg is how the COVID-19 positive case, but beneath them, there are rapid increase of deaths in self-isolation. So prevent increasing undetected contacts, maintaining essential services, and decrease the risk of another wave in which hospital and primary healthcare services become overwhelmed. So we came up with a solution with Indonesian National Disaster Management Agency, or BNPB, together with Ministry of Health, Ministry of Education, Culture, Research, and Technology, with Provincial Health Office and District Health Offices. And we also tried to involve several universities as the key player. We initiated a pilot program which involves university students in COVID-19 tracing and testing efforts. And the pilot program was formed through coordination and communication between governors, ministries, NGOs, and university to create the best possible implementation, the best possible program to give a big impact for accelerating the handling of COVID-19, while simultaneously evaluating them, because university students came as actor, as the key player, but also evaluator, because they are not part of the healthcare facilities, because they come with a fresh brain, a new mindset, and bring new hope to the primary healthcare services workforce. Lessons are drawn from experiences planning, executing, and assessing regional programs involving university to support PHC in Bali. And we found some of the, also here is the distribution in provinces in Bali, districts in Bali, which including Badung, Denpasar, Buleleng, Tabanan, Gianyar, Klungkung, Karangasem, and Bangli. So we came up with the 535 university students, mainly in the health and health science studies. So here are some photos, which is very memorable for me, because here is picture university students with level 3 PPI. Try to PPE. They conduct with primary healthcare services workforce testing, and this is of course testing which help not in the primary healthcare service building, but they came up with a solution to actively approach community alongside with police force in Indonesia, or Polri for short. Firstly, I would like to address this. What did we find? So the integrated involvement of universities and TNI Polri in COVID-19 medication is undoubtedly still new in most regions in Indonesia, and I believe it is still new in most of your country. Handling the pandemic requires a lot of qualified human resources, and I believe university students are those people, qualified human resources participating in the pilot program. We do have a scheme by the Ministry of Education, which is an emancipated learning scheme by the ministry. The scheme creates an ecosystem of active and practical learning through interprofessional collaboration, or IPC. So we came up with a solution, tried to put the scheme to place, and the collaboration between the TNI Polri and students, which is greatly depicted by the picture in front of you guys, has greatly helped the shortage by the tracing personnel in the field, testing personnel, of course, which was previously only carried out by the PSC, or primary healthcare workers. So the TNI Polri acts as a law enforcement figures who go into the field. Meanwhile, the students help in terms of increasing knowledge, delivering the contacts, and ultimately increasing PHC tracing and testing capabilities. These increase the public supportive and cooperative attitude, honesty, and willingness and initiative to carry out the testing, and to the desire to be quarantined, isolated, or seek appropriate therapy. Another thing that we found is that the real-time tracing data that is not recorded in the monitoring system leads to inaccurate daily records, which consequently may lead to a growing number of data not being input right away and ineffective or even late response. Because what do we endorse is data-driven policy, in which when data didn't back it up, I think it's not very ideal. Lastly, inadequate self-isolation monitoring. So some monitoring systems were also known for not having enough features to accommodate effective self-isolation reports, and consequently this may be the culprit of inconsistent self-isolation behavior due to inconsistent monitoring by PHC, cadets, and different part of the mitigation team. So what do we recommend? Before we came to the recommendation, I would like also try to quote some PHC healthcare workers that involved in the program, and their quotation and their testimonial. They said, to be honest, the help from the educational institution in contact tracing at our primary healthcare came at a great timing. So what did they mean as the great timing? Because there were hundreds of patients, but limited human resources prevented them from optimizing the contact tracing and self-isolation monitoring, because they're trying to survive in treating the patients. Another PHC staff notes that the involvement of university students really helped them in almost all PHC activities, not only tracing, but also educational videos, COVID-19 preventions, and helping them in offline and contact tracing vaccination programs, and of course, including the data analysis. So from the front to the end of the efforts, we hope that this initiative will be continued, and I really do hope that you guys can take some notes or the good part of the presentation and try to replicate, and I believe will be duplicated and even escalated to another different level in your places. These are some of the testimonial, not by the PHC or the primary healthcare staffs, but from the students that are involved. So they told us that they learned some new skills, including promotive and preventive education skill, coordination and advocation. I would like to highlight some of the main ones, including COVID-19 control and community level, interpersonal communication, critical thinking, problem solving, and data management, which are very important. Not only try to help their communities in mitigating the COVID-19 pandemic, but also for themselves, as they are still students and will be the future of the healthcare workers, and also part of the community as well. So what do we recommend? We will also like to recommend that this recommendation comprised of 2 action plans for each public element, and I believe can be replicated in your countries. Implementation of the emancipated learning, if you guys have one, or maybe try to encourage the creation of a scheme of emancipated learning, which involving Ministry of Education and other related ministries and institutions. We'd also like to recommend the encouragement of university leaders to see this scheme as an opportunity to integrate academic activities with increasing participation of their students in COVID-19 mitigation efforts. University students are known to be more fluent in using technology, and we all know that. In addition, medical and health science students are also known to be able to help primary healthcare staffs to educate and to answer questions from the public regarding COVID-19 transmission, as mentioned by Mr. Reshad and as mentioned by Mr. Reshad and Dr. Arisha before, that we also need to encourage more and more promotive and preventative efforts in COVID-19. They also are able to conduct self-isolation and to debunk health-related myths with evidence-based information, as of course they are trying to be as academic as possible. This good baseline ability and standard can be developed and increase even further. And we recommend universities working with the ministries, PHC, or public healthcare facilities, regional health offices, experts, and NGOs to create a learning experience. This is the key one, to create a learning experience or modules to help strengthen and sharpen student skills. This learning experience will also be a good common ground between university students and other collaborative, like TNI Polri, and so on. Another recommendation, including the monitoring system optimization, this can be achieved by integrating between systems or the use of a uniform system or application nationwide. I believe some of your countries already use the scheme. The system has to be simple with an easy user interface and the ability to accommodate all features, including self-isolation monitoring reports, because in the bigger countries, including Indonesia, self-isolation is the key to help contain COVID-19 transmission in the communities. As I mentioned before, that COVID-19 cases might be erupting, but beneath the tip of the iceberg is the COVID-19 transmission in the communities. Okay, so I think I came up with the last 3 slides of my presentation. I will also try to mention that this presentation will also able to be conducted, the programs and the efforts, because all collaborative works from the all the ministry and the NGOs and all involved, including the National Disaster Management Agency or BNPB, Ministry of Health, Ministry of Education, and Provincial Services, and National Army and the Police Force of Indonesia. It's great to talk to you guys. This is a very great opportunity from Mas Hanif. I'd also like to acknowledge you that this is a very good opportunity for me. Lastly, these are the three people that work alongside with me. We all are junior doctors, and as I mentioned before, that we might not be the most capable or the most influential person or people, but these three people inspire me. Like, of course, the You Inspire Lines try to inspire more people, and these 3 people inspire me in creating a better Indonesia and better mitigation of COVID-19 mitigation efforts. Because this is a very good quote from General Hugeng, the first head of the National Police Force Indonesia. Baik menjadi orang penting, tapi jauh lebih penting menjadi orang baik. Or in English, it's good to be an important person, but it's more important to be a good one. We came up with a solution, tried to implement them, and here we are, try to inspire all of you with our experience. Back to you, Dr. Vivien. Thank you for the opportunity, and I'm hoping I could end the talk with a high note. Thank you.
Thank you very much, Aditya. You definitely did. Thanks for showing us the really brilliant example that if we involve the youth in any changes, the youth will come with the wonder plan for us. And given the urgent need for the contact tracing, you guys have come up with a brilliant way of involving the student lead community contact tracing program, partner with the university, while at the same time, you guys are empowering the youth involvement in this pandemic crisis. Your work definitely validate the efficacy of the student lead volunteer contact tracing program to respond to, I would say, local, national, and regional contact tracing needs, and providing the evidence for the untapped potential for the community contact tracings in the COVID-19 crisis in your country. Definitely, you guys are doing a very good job. Kudos to you all. All right, dear participants, we are come to the end. Yep, great, Adi. We are coming to the end of our session. Thanks to all the three speakers. So now is the time to unboxing all the Q&A session. So if you have any question to Dr. Arisha, Dr. Aditya, and Ahmad Reshad, please do type your question at the chat box, or you can leave your comment at the YouTube while we are doing our live, or in the Facebook, regardless of any channel that you use. If you have any questions, please leave your question here, because it is not easy to have three of them in front of the screen together, despite we are sharing the different time zones. They have a busy schedule. So let me check the chat box. While waiting for your question, I think I will ask the question myself. I do have a question. I think that question is actually meant for each one of us here. So we know that You Inspire is the platform where we gather the youth and also the young professional. So this question I wanted to ask any one of all the speaker in front of me here, that when it comes to the pandemic issue, Dr. Arisha has shared the importance of vaccination, Dr. Aditya has shared the importance of contact tracing, and then Reshad has shared the importance of having the government and also the NGO humanitarian support and whatnot. My question here is, how do we actually making changes or influence the youth or young professional from a non-medical and health sciences background to be one of the change maker in this pandemic? I think Dr. Aditya was mentioned that Dr. Arisha or Reshad can answer the question, because we are talking about people who are not from the medical or health sciences background. How do them involve as part of the change maker in this pandemic, so that they won't feel that this is the method of the health issue, I'm from the engineer, I'm from some other background, so I couldn't contribute much. What they can do? What can they do?
Okay, can I take that? Okay.
Sure.
So as I would like to say that it's not just the pandemic. Health in general should be a topic that is discussed by everyone. Everyone is responsible for health, not just your health, but the health of your community reflects on your health. The health of your nation will also impact your health. If we can see Mr. Reshad and I right now, I mean, I have classmates from Afghanistan. I have one classmate from Afghanistan, and I totally understand. He was working for the Ministry of Public Health in Afghanistan. So I can understand the importance of health being something that is not just limited to doctors or healthcare professionals. So when your question was how can we engage youth and young leaders? I think Aditya is a good example. These medical students, I know they are in the medical field, but they have friends who are outside the medical field and friends who are in other sciences, and not necessarily just sciences. Like I said, when I was working with the vaccination program, I even had artists, street artists who were volunteering in the vaccination program, who came and put on performance pieces while people were waiting for their vaccination program and giving them directions on where to go. We had people working from the service industry, manage hospitality and management industry. So who Air Asia, they were helping guide people to go to the correct centers and correct locations. So every individual, it's an initiative of your own. I think we can, if we educate people, education is key. If we educate people and give them avenues and opportunities to come forward and present their ideas or suggestions or, help the community, I think people are remarkable if we give them the chance. That's my opinion. So that's how I think we should engage the community. Thank you.
Thank you, Dr. Arisha. Very powerful message. Aditya, you want to say something? You are representing the youth, basically. Among all of us.
I believe that all the speakers, including us, all of you guys in the US, you inspiring people and inspiring youth with all the greatest mind. My additional notes is that another efforts that I do with the team, including Mas Hanif, Mbak Melisa here, Mas Basra, also enjoying the You Inspire Coco Talk this evening in Indonesia, is that the ideathon, or we try to involve university students and university professors and researchers in Bali, all educational background, including engineering, tourism, to put ideas and try to put their ideas in the melting pot, because the forum, like Dr. Aris said, that this kind of forum is very empowering people. So engineering professors try to show how to conduct the best COVID-19 mitigation efforts in their field. Tourism professors try to tell us about how to conduct the COVID-19 mitigation effort based on their educational background. They all have their own take, and I believe we are trying to put the same spirit here, which try to contain the COVID-19 transmission, COVID-19 cases. And I believe I want to try to encourage that all youth from all educational background try to see the COVID-19 as their part, as their opportunity to learn more, because there's so much that we can do. We didn't need, we all didn't need to be a part of the medical team, but I believe this is a nationwide or even globally affected.
Thank you very much, Shadia.
Yep.
Reza?
Yeah, can I have a
sure.
very quick comment? Actually, I would like to just clear the rule of networks and platforms, because the pandemic is affecting everyone in the society, and individually it's a little bit difficult to go out and do something, but when we are together we can do a lot of things, and people are trying to join with the network and platforms to go in a teamwork to do something. It had a good role in Afghanistan while I was working with the Kabul municipality as a director of one of the districts. Networks from civil society were coming to our office and voluntarily asking and telling that it is a pain for everybody, for our family, for your family, for all the nation, but what can we do as a team, as a network, because it is a responsibility of humanity to deal with it and to protect the nation. and we could give them some parts of activities, then you can do it, and they were voluntarily do it. And I think what I am trying to focus on, and also tell that role of network and platform is crucial while it is involvement of illiterate people in this kind of activities, because literate and educated people will definitely try to find some ways, but making some opportunities for those who are illiterate or those who are willing to have this kind of activity. We can invite them to this kind of networks and to participate as a team for this kind of activity.
Thank you very much, Reza. I think the key takeaway I can get from all the panelists here is, whoever are you who listen to this now, you have to head up and chin up and knowing that pandemic is not only for the medical and health science people. Pandemic is for everyone. Regardless of who you are, regardless of what profession that you are, we are counting on you. So there's no excuse of saying that this is not my profession, I'm an engineer, I'm a mathematician, regardless of who you are, find your role in the society because the society is calling you. All right. Thank you very much. I want to keep the momentum, so I won't take a pause. There's one question from the chat box. I think this is to Dr. Arisha. In Indonesia, information, I will read that out, so maybe Dr. Arisha can also go to the chat box. In Indonesia, information about the adverse event following immunization is not accessible. Meanwhile, these informations and major hesitancy factors on several survey of vaccination is the adverse event following immunization. So how about Malaysia?
Okay, in Malaysia, like I mentioned earlier, we have an application where we have when we go to get our vaccination, the mobile app, you can actually respond in the mobile app on your adverse effects. Mild adverse effects is simple, but when it comes to more severe adverse effects like actual allergic reaction or shortness of breath or something more severe, these people seek healthcare professionals for help. So our pharmacy system, the Department of Pharmacy, they are in charge of, they were given the responsibility to understand and evaluate adverse effects after vaccination. So all AEFI reporting was directly handled by one department. When that happened, they had a central database created and they disseminated formats to every single health facility in the nation. So every single doctor or healthcare provider in the country, once someone develops an adverse effect following vaccination, they approach or they go to a healthcare personnel. The healthcare personnel is able to report back to this central database that collects the system. So that way, this AEFI information is also transparently provided in my Ministry of Health website. All the information is public, readily available. We have autopsy reports, we have information on how many deaths post-vaccination, how many deaths directly related to vaccination, not related to vaccination, suspected related to vaccination. Such information and that transparency is what gave, I think, in my opinion, is what gave my Malaysians the confidence to go and get vaccinated. So I think Indonesia should, I'm not sure how your system works. So if you have a system where you collect the report of AEFI, someone has to be collecting the information of AEFI. So combine that report, concentrate the information and disseminate it to the public. I know it sounds scary. Sometimes it sounds scary because you think that when people hear, oh, vaccine can cause death, they won't take the vaccine. But no, it's not true. If you tell them that 10 million took the vaccine and 1% developed rashes, they would understand the magnitude and the importance of it. That's my opinion. Thank you. Thank you, Miss Basra or Mr. Basra, I'm sorry, for the question.
Thank you, Dr. Arisha, for that, for answering that questions. We are definitely behind the time, so I see, I see that if you have more questions, what you can do is you can drop us a message, and we'll definitely pass your question to either Dr. Arisha, Aditya, or Reshad, and definitely the question will be answered. If not today, someday, whenever you have the question, just don't hesitate to drop by and ask us any question. So next, we have a key takeaway note, which will be shared by Saran Prakash. She is the PhD scholar from India and a member of Confederations of Risk Reduction Professional India and from the You Inspire India chapters. So Saran? Yep, the floor is yours.
Thank you, Dr. Vivien. I'm so sorry. I was trying to unmute myself. Am I audible?
Yep, we can hear you.
Okay. Thank you. I'll take a few minutes to and summarize today's session with a brief set of key takeaways. And to begin with, I think such a relevantly fascinating and engaging session. I mean, no amount of appreciation can be enough for all that our esteemed speakers have been doing so far. So firstly, I think hats off and hearty thank you for that honest sharing with us. In the past 2 years, we all have been knowing about what and where of COVID-19 management across the globe from different sources, including news and the social media. But I think it is an old realization that hits us freshly yet every time, that learning from those who have had first-hand experience gives us a very different perspective of looking at things. So yeah, in this light, I think Dr. Arisha, she shared with us in detail the strategies that they carved out during their encounter with vaccination drive especially. And she shed light also on the stratified data on the factors which contribute to vaccination. COVID-19, it was a challenge for everyone in different capacities. And more than that, it was a shock, if I can use that word, which came with more of totally unknown and unpredictable set of elements every new day than any amount of predictability. So acknowledging that, accepting that with a sense of determination of we can do it together takes not only a scientific approach but also a humane approach, where we where different systems in a society understand and work together in sort of a sync with each other while appreciating the efforts made by each. So in that context, again, Dr. Arisha sharing her sharing, it reflected an old theory that we study in political science, which is called systems theory. What comes across as an important takeaway from her sharing is that disaster management in general, as a whole, it cannot be done in individual silos. So we need a collaborative and coordinated functioning to make it through the telling times. Then in our everyday conversations, we quite often use the term multicultural. But how often do we even try to guess the expanse of that multiculturality? When Mr. Reshad was sharing about different concerns that the providers of aid and assistance had to take care of, it offered me at least yet another angle of looking at the situation so far. I mean, up until now, for many of us, the challenges surrounded concerns like how to maintain physical distancing, or that doctors were having to work overtime, which are all right points from for all the significant reasons. But I also strongly agree with Dr. Vivien when she said that we actually do not hear all of these points from anywhere else. I mean, as much as we always dread this concern, the dead body management, it is a heartbreaking job for anyone. But in the scenario of this latest disaster, Dr. Reshad brought to light the intricate needs of taking care of community sentiments and at the same time balancing between contact tracing and preventing further spread. And also, I think a buzzword all this while that has been around is the community transmission and the need of controlling the same. Now, if we have to mark out yet another key takeaway from Mr. Reshad's sharing, it was the need of applying, as in we do know what, but how should the concept of how that should now become the focus. And as he was speaking, the need for community-based disaster risk management, or CBDRM as we call it, was constantly echoing in my thoughts. The need for CBDRM, I think it cannot be emphasized enough when largely the countries are multicultural and multi-ethnic, when what may work for me may not work for a community which is staying just 10 miles from here. And as just right now, Dr. Arisha had said, we all need to talk about health in general for the common good. And it is a collective responsibility. And a responsible community which identifies and works along with the aid agencies and humanitarian relief agencies can be called a risk literate one. And that is always a good news despite a disaster. Then finally, moving on to the last speaker of the day, I actually wrote my master's dissertation on the role of academia in disaster management. And probably that is why Dr. Aditya's focus of it was of personal interest to me. For a major part until now, we have looked at the impact of COVID-19 on educational institutes or on universities. But Dr. Aditya's his sharing it informed us with a very unique lens of how they can be helpful in the management of this entire disaster. So as we can take away from here again, if the field agencies shared their knowledge, or rather points of view at the platform of interfacing with the academia and the universities, or in general, while planning the needs and the vulnerabilities of the communities under consideration, they can be factored in, while also planning, as I was saying, appropriate measures for each phase. So I think this interface will not only bridge the gap between the initiatives taken by the field agencies and the academic knowledge, but it will also ensure to accept community as one of the primary stakeholders in the proactive phase of disaster management cycle. And academia as a stakeholder becomes significant because knowledge is the key to facilitating education and awareness, so that disaster management planning is ensured to be active at, I think, the grassroots level. So that was it for today. Thank you for lending me your patient ear. I'll hand over the floor back to Dr. Vivien.
Thank you, Sarah, and thanks for the great summary. Thank you, Sarah, and thanks for the great summary and also the key takeaway. Now, dear participants, it has a little bit of time. We have 1 hour and 45 minutes now. So the last message from me is that before we end the session, we wanted to remind you that COVID-19 is the historical context of the public health crisis. And as our speakers share their perspective and experience together for the past 60 minutes, I have searched online. The death toll of the COVID-19 across the world now, as of now, has surpassed 5,361,003 cases, casting an even larger shadows of uncertainty over the future. The harder the crisis hits us, the more we have to look for the positive changes that it facilitates. The COVID-19 pandemic can be the most effective moment in which we disrupt the unhealthy norm and validate some new possibility. Globally, we have a mixture of accumulated knowledge and technology and the human capacity and the capability to learn, to innovate, to develop a new knowledge and translate that knowledge into the application to solve the crisis and this pandemic. And our speaker have keep reminding us that the new norm today shall focus on giving rather than taking, on solidarity rather than individuality, and on care rather than indifference. As we remain physically apart, let us see this as an opportunity to practice our muscle of commoning and build the strength to care for ourselves and others. Remember, none of us are safe until all of us are safe. To all the youth and young professionals, regardless of which profession you are from, thanks for the direct and indirectly making a changes and difference in solidarity with others to end this pandemic. We shall overcome this together someday in the near future, very soon. And if you are new to our portal, You Inspire Alliance or You Inspire Country chapter, do find us at Facebook, Instagram, and YouTube. It is the platform where the youth and the young professionals like you are welcome to join us for the safety capacity building. Till then, stay tuned. Keep in touch for our next and upcoming program and chocolate talk. Merry Christmas and Happy New Year. Assalamualaikum. Bye-bye.
You Inspire Alliance is a network of youth and young professionals working in science, engineering, technology, and innovation.
You Inspire Alliance provides the platform for youth and young professionals to connect, engage, and learn from other youth and experts in the region.
We are not only at the international conferences or at the laboratories. You Inspire is working together with the local community in the field.
To participate in decision making, demonstrating their ability for advocacy, communication and consultation, as well as leveraging advanced technology.
We strongly believe that inclusivity is the integral factor of DRR. Hence, all our work and projects are people-centric and from the communities on the ground.
We are committed to supporting youth leadership. We are happy to work with the You-Inspire Alliance.
You-Inspire Alliance bridges the gap between professionals and young specialists and make it possible to exchange knowledge and experience between Asian countries to make them more resilient.
We work with youth and the young professionals from the academe and the industry sectors to build back better in a post-pandemic world.
You-Inspire has connect us and bring us together to contribute for disaster risk reduction and climate change by utilizing science, engineering, technology, and innovation.
Thank you very much. Thank you very much. I know why you guys are staying, because you are waiting for the group pictures. Now that we are doing this, who will take the picture? Ifa, are you?
I will help.
So let's switch on your camera.
Okay, maybe please turn on your camera.
Hiya.
And also
Aditya has left.
Yeah, no worries. Thank you. Okay, I will start. Count 3, 2, 1, smile. Okay. Okay, once more. Wait a minute. Okay, count 3, 2, 1, smile. Okay, thank you so much, guys, for today.
Thank you. Thank you very much.
Thank you so much, participants.
Thank you so much, everyone.